Hello everybody, as you heard, my name is Dechsling, and I do my research on virtual reality and autism, and I'm affiliated at Østfold University College, where I work as a doctoral research fellow. My project is led by Anders Nordahl Hansen, he's the project leader at Østfold University College, and along with us we have, among others, Stefan Sytterlin, Roald Øyen at the University in Tromsø, Torun Lian at Oslo Met, Hugo Kogomoreira at Østfold University College, Fred Sheik at University of Washington, Fred Volkmar at Yale University, and also Stian Orme at Innlandet Hospital Trust. So this is not a submarine, but it's actually the first Sensorama VR machine from 1956 by Morten Heilig. So, and this is one of the first head-mounted displays by Sutherland in 1968. So virtual reality is not necessarily a new technology, but it has developed a lot. For instance, you now have various versions of head-mounted display, such as this cardboard version, where you can put your smartphone inside it and have a sense of virtual reality. But you can also have these head-mounted displays with inbuilt projectors and screens that allows you to be completely surrounded by the virtual environment. And you can also interact in this environment by using controls of various versions, but also using gloves or even just your hands. Other ways of being presented for virtual reality is this kind of cave, which has projectors on walls surrounding the user, giving you a feeling to be in a virtual room. This uses Kinect sensors, but also Kinect in its own self, like on, for instance, the old PlayStation or Nintendo Wii kind of technology, that are actually sensors that make you, that allows you to interact. And you have social robots that are also under this this umbrella. And augmented reality is a quite familiar technology for most people because of it's actually digital components superimposed on the actual environment. So you're familiar with this from the filters in your phone cameras, for instance, where you can put different types of stuff on the actual environment. But you also have these AR glasses or smart glasses, where you can wear these glasses and you can get these digital cues superimposed on the environment that you are looking at currently. So for VR and autism, there are many advantages, we think. For instance, Anders already mentioned some of the challenges for autistic children or autistic individuals. One of them could be transitions. For instance, if you, in this case, there's a large swimming pool area that are scanned by 3D, where the children actually can be at home watching this, walking around within this swimming pool area and getting familiar with it before they actually go there themselves. I've done this a couple of times in clinical practice, and it works like a charm. And you also have schools doing the same thing, scanning their whole school so that the autistic students can prepare themselves before going there in person. There are other things that could be advantages in VR. For example, as you already know, social communication and maybe could be some challenges inherited with the diagnosis, and then you will have the opportunity to train on these kinds of social skills without the unwanted consequences in real life, but you can actually train these skills in a more safe environment before applying them to the real life. So these are some advantages that we think that VR can contribute with. And you can also make individual adjustments to the faces or appearances or whatever you need in VR. The research on VR and autism in this century was on average in the first 10 to 12 years on about 2 or 3 studies per year, maybe. Then the next years, it actually enhanced quite a bit. And the last 4 years, it has been substantial, the increasement. The VR and autism research is quite complex since it's a new field. It's a lot to think about in this research. You have the implementation factors, you have the acceptability, the feasibility, piloting studies. You need all this in order to make a good enough interventions in the end. So the first thing we did in this in our project was to look at the acceptability of the autistic individuals themselves on using VR. So in this paper, we found that in all the literature, there was almost 90% positive attitudes towards using VR and computer-based technology from the autistic individuals themselves. And when looking at the studies using head-mounted display, you can see that over 80% were positive, none were negative, but some were inconclusive. Meaning that in the study there was not 100% positive in the study, because if there were some negative and some positive within the study, we called it inconclusive. So from the data we have to recognize that there are could be some bias in who is actually publishing their evaluation data. Do they publish it if there are negative evaluation data or report it? And who's asked? But by the data we have for now, it's an overall positive acceptance towards use of VR and computer-based technology. And therefore, we can go forth with the research. So the step 2 was to get an overview. And the first thing we did was to do a systematic review. And in this paper, we did a scoping review, meaning that we want to look at the gaps and holes and missing pieces in the research. We evaluated almost 50 studies on social skills and VR. And the first gap that we found was that less than half of the studies report acceptability data. And we mean that all data should report on the social validity or the acceptability of the use of VR for the autistic children or individuals. The second gap is, in autism field, we say that the ratio between the gender ratio is about 3 to 4 males per female. But in the VR research, the gender ratio is even higher. So there's a gap on using VR with female autistic individuals. Another gap in the research is the diversity in the, as Anna showed you, the spectrum of the diagnosis on IQ, on language and skills and functioning. It looks like it's the lack of diversity in this. For example, children with co-occurring diagnosis are underrepresented. There are also a gap in using VR for older adults or young children, and we need more research on using the head-mounted displays within VR. When looking at the evidence, we could see that there is a lack of randomized controlled trials. But there's also a lack of diversity in studies. So for now, it's mostly feasibility and pilot studies and small-scale studies. So we need more diversity to say something about the effects. And the seventh gap is the lack of theoretical grounding. It could look like that VR research are mostly ICT people applying with less knowledge on autism, applying this technology, or vice versa, autism people with the lack of knowledge on the ICT and VR. So we need to, there's no studies on using the theoretical grounding on the autism interventions that we know about before without using VR. So our next step was to look more into that. So what we did is in this study, we looked at the best available practice, the intervention strategies, which are the naturalistic developmental interventions, the NDBI. And the core elements of NDBI is training a wide range of skills in naturalistic learning context, combining different elements and strategies to boost learning in various settings. So, when reviewing the literature, we found no studies applying NDBI in VR. However, we found some studies applying some elements and strategies from NDBI, almost 10 studies. So then we made a conceptualization of a theoretical grounding and coining the term VNDBI, Virtual Naturalistic Developmental Behavioral Interventions. So in our research, we want to build brick by brick. However, it's quite complex field. So what we've done so far is to look into the acceptability, because if there were no acceptability from the autistic individuals themselves, there were no reason to go forward with this type of research. We have applied some theoretical grounding. We make sure to have participant design, meaning that we include autistic individuals themselves and also their stakeholders. We validate our content before applying it. For instance, we have had a survey on different avatars using emotion expressions to make sure that we have the validity of the expressions before applying them to the VR programs. And we also investigated implementation factors for example, in schools. And then when we have all these stuff put in place, we can start with the testing. So there's a quite big process before we can start testing the actual VR interventions. That's where we are now. Thank you.